Hello, so my name is Simon Denegri. I used to be chair of Involve, which is the national advisory group for the promotion of public involvement in the United Kingdom. And I've since then been the NIHR National Director for Patients, Carers and the Public in the UK, trying to promote and advance public involvement, but also better access for patients to research through the health system. So I think joint dementia research has been a really important innovation for us and for people with dementia and their caregivers. And I think it goes back to the point of promoting access to research through the health system, through our National Health Service. It's clear that we had a problem that needed to be solved, which was that many people were not hearing about research, that it was difficult to get trials up off the ground because they were finding difficulty in recruiting. So we needed to find a way that would enable people to hear about them, but also register their interest in participating, but also enable researchers to find them. And that really is the basic level, the whole idea behind joint dementia research. It's a sort of dating app, if you like, or dating website where they can find one another. And I think the really great thing about joint dementia research is that from the very beginning, it was designed with people with dementia and carers involved. So they helped us with everything from the IT to the governance to what the website to what the communications looked like. And I think that made it a really practical, feasible, implementable initiative. And I think it's proved that by its success in how many people have registered and in the number of studies that have been, used it for recruitment, and the number of people who found their way into clinical research. So first, the most important thing I would say, I think it's great news that you've developed StepUp for dementia. I think it's a brilliant initiative, and I think you've got an opportunity to learn from joint dementia research and improve and perhaps be better than what we've developed. I think what I see it being is that realising that ambition, which is I'd like to see every person in every health system, patient, caregiver, to at least have the opportunity to hear about and to learn about research as a possible choice as part of their treatment. And I think that's the goal we need to get to. Not that we want or should try and aim for every person with dementia to be in a study. I think there's lots of difficulties around that concept, but the pure fact that people can have a conversation, can get basic information, that they can learn about research and can put their name forward, I think it's a really important, actually, human right to have within the health system. So I think if StepUp for Dementia can realise that would be wonderful. And I think there's no reason it can't, as long as all the organisations who are part of the dementia research world get behind it and promote it very actively across the population, because it won't happen magically. It needs a lot of work, a lot of positiveness, a lot of persistence, a lot of patience in building awareness and building profile. So I think the three lessons that I've personally learned from joint dementia research, whether they would be the same for other people, but I think it would be true of many of them, is number one, keep it simple. So it's really important that you have a very simple message and a simple idea behind it. Two, I think listen to your people with dementia and caregivers and what they're saying about it's how to do it, how to make it more effective, how to use them and use their own networks and ability to reach out to people. And I think the third thing is build an ever wider collaboration and make sure that collaboration is about presenting the message within a healthcare setting. So I think we have still a lot of way to go to make sure that anybody with dementia who's diagnosed will soon hear about joint dementia research. And I think it's all got to be presented in context within that situation where they're starting to receive care and treatment and it's becoming a choice for them. And so I think that's the thing that we still have to try to get to, and I think that's somewhere where perhaps StepUp for Dementia can learn from us and improve upon. Well, I think I have a few really. One is it's just very successful in presenting that research message and opportunity in clinical settings and with people with dementia and carers directly. And I think if we can get to that point where everybody's hearing about it, that will be a wonderful goal in itself. I think actually one of my other ambitions would be great to see StepUp for Dementia and joint dementia research replicated in other countries, and then these things to come together in some form of international alliance which will facilitate research across boundaries. Because dementia is an international disease. It doesn't respect borders, not in the way that health systems have to. So I think it could really play a massive role, and there could be some really interesting learning, I think, from these different devices about how to connect with patients, what makes it, what are the deciding factors for them to come forward. We could learn so much from these devices. And we could also use them much more actively to do things like citizen science. So I'm very interested in, can you use StepUp for Dementia to do citizen science projects, perhaps research projects that are led by people with dementia in their care areas. I think we can do many things with it. I think it's about focusing on the one or two which we think are going to really make the difference. So I would say to people who are a bit apprehensive about something like StepUp for Dementia is, please don't be. We need you to help us. You're under no obligations to do something, even if you're registered. Your information is secure. Get used to the information, visit it regularly, try and get yourself comfortable with the notion of what research is, and to regard it as a choice and as something that may actually help you. But I suppose the other one is, I completely understand your apprehension. It's a big step for people to take. But this is all you're really doing, is giving a message to researchers that you are willing to be contacted and would be interested in being part of something, and you still have the right to say no. So you still have that power. I think that's really important for people to know. Finally, just like to say good luck, and I hope people get behind it, and I hope it, I hope it makes a difference. I think it will do, and I look forward to supporting it in the future.